Okay, Shaykh Abu Eesa, Mufti Amjad talked about herd immunity. Maybe we can sort of describe herd immunity as if a certain percentage of the community have a certain immunity to a particular virus, which clearly is causing a lot of harm. There still is that skepticism, people who are still questioning COVID, whether it's actually no different to any typical virus. I mean, all you need to do is just go to the your nearest Muslim graveyard, and you'll see the number of deaths that you would find at this time of year, relative to this particular year in particular, is quite large. You know, you must be completely on a different planet if you don't think that is infecting and causing deaths from that particular perspective. Anyway, so back to this point of herd immunity. The herd immunity issue sits on the idea that a certain percentage of the community are vaccinated in this sense. And if they are vaccinated, then that will be a protective factor for the remaining people also, you know, against that particular deadly virus. So how should the Sharia see this? And this is quite a novel subject because it's not always, I mean, even from my understanding, from my own study and research, it's not something that's directly related, but I suppose we talk about issues like maslaha, for example, and avoiding mafsada, and we talk about hajat al-am, and various other sort of concepts that get introduced within the subject. How should Muslims perceive this? Because if we're saying that a vaccine is permissible, we're saying it on the basis that there are no sort of haram ingredients, for example, on that. Unless it's an issue of tadawi bil muharram, whereby there are certain conditions we have to accept. There is no other alternative, for example. It's clearly proven to be effective. So Mufti Amjad talked about ghalabat al-dhann, for example, and clearly something which is easily accessible. These are certain factors that would be required of us. But when you're looking at herd immunity, and we're asking somebody who's now asking this question, and their question is, can I take a vaccine containing impure substances to benefit herd immunity and save lives when I am at the lower risk end of the spectrum? I'm young, I don't have any comorbidities. It's a difficult question, Shaykh Abu Eesa, and you don't need to answer that directly, even if you sort of give us talk around that subject. What would that be? What would the perspective be to that? I recognize we've got Pfizer, which is vegetarian, so alhamdulillah, we're very this is a great blessing from Allah that we got a vaccination like that. Let's say we were in a situation, hypothetical situation, where that wasn't the case. How would the Sharia, or your opinion of the Sharia, how would it sort of take that sort of decision?
So on the issue of a vaccine that was impure, let's build it on that. All right,
Okay.
let's go worst case scenario. As Mufti Amjad said, right, the issue of excipients is a matter of scholarly difference. There are some that consider it to be okay, because those who would be untrained would just say, listen, it's a need, so, you know, no problem, which is obviously weak, and, you know, as weak from every angle. Then there'll be those that will consider it to be okay because actually there is no impermissible excipient. It's changed in its state, and I don't want to bore anyone with that. I think all of the speakers here will have no doubt taught about this subject and medicines and vaccines, and the audience can go and research on that. But there are those that will consider it to be, let's take again worst case scenario. I don't consider porcine derived gelatin or whatever excipient to have changed. It is there enough in a material sense to still be haram, and therefore I consider the vaccine personally to be haram. So if this is the scenario right now dealing with this, can I be obligated to take this? If so let's now go to an Islamic authority. If it's an Islamic authority, if you're living in a Muslim country, the ruler was to give the ruling, then I don't even need to get subjective about this. The Majma' al-Fiqh al-Islami has already passed a fatwa on this 25, maybe 30 years ago. Okay, that was back then when the evidence was, I don't want to say poor, but the working evidence was certainly a lot less than what it is today of the impact, the importance, the political health, the financial consequences of not taking medication, especially in a pandemic. So what about now? So that's already been given a fatwa that it is obligatory to obey an authority. They were talking, of course, in a Muslim country, but I'll come to that in a second. They're obligatory to obey the authority that forces you to take a medication stroke vaccine in order to curtail a pandemic or an infection. All right. Again, this was in that era where the information isn't even to the level that we have today. That would be for something which is even impermissible, because the impermissible excipient, according to the principles of fiqh, becomes permissible even if we consider it to be impure, if there is a need, let alone a necessity. So the fatwa which is being given, if it was given, and I also want to respect Mufti Amjad for what he said. Us as individuals, regardless of our backgrounds and whatever, it doesn't matter to us whether you take the vaccine or not. I got a call from a person that I'm not going to actually forget who it was, who asked me, should I take the vaccine or not? A top scholar in this country, 2 days ago. He was given it because he's frontline. He was offered it frontline. I said, yeah, if someone gives it to me, I'll take it. Certainly take this one that has absolutely no involvement with gelatin versus the ones that are going to come, and then there's going to be discussion about it. But even talking about those, if there is a need and it is established that it's going to play an essential role for herd immunity, then it is obligatory to take it, even though I consider the vaccine in of itself to not be obligatory to take, not even necessarily recommended to take. My personal fiqh position is the Hanafi position, in that it is permissible to take, no more, no less. But there is a concept of herd immunity, and not the incorrect one. You see, the problem is that when the government messes it up, royal mashup of what they did, like they've turned it into this political football that they tried to use in the early stages, and they lost the masses because they were talking about herd immunity by letting people get infected by it. And take the risk of getting killed by it yourself, not a vaccine-based one, but actual natural infection. And they called that herd immunity, messing up the concept for all of the scientists, the public losing trust. Herd immunity is meant to be something which is an active process in which you use a vaccine that's already been established in its safety profile, enough established safety, as not obviously nothing's going to be 100%, to create at that level of herd immunity. And so now people have already lost trust with the concept. Now is the time when it's meant to be applied properly according to knowledge and facts, and people are now not interested. So to reset the issue, if the question is asked, if it is established that it will establish herd immunity, that it will protect the wider community, even if you are at low risk, you're young, fit, healthy, etc., and the authorities decide to, even though of course they haven't and they won't because it's too politically controversial, but if they were, then it wouldn't matter if they're Muslim or not Muslim, because the hukm is manut bil maslaha. The ruler that rules, and our obedience to them is not because they are Muslim. It is based upon the benefit. It is based upon the maslaha. This is a qaida fiqhiyya, which is a maxim in jurisprudence, which is well established. And so therefore, if it was given, then it would also be obligatory, hypothetically, for us to take that to save other people, not even if we're affected. Let alone people who have already been infected, by the way. I'm talking, if I'm going to make it a worst case scenario, I'll say young, fit, healthy, who's already had the infection and got some natural immunity. Even that person would be obligated if the authorities said that you need to take this via herd immunity through the vaccine and its specific immune response in order to protect the weak, the elderly, and so on, if that ever happened.
Okay, Dr. Asim Patel, I'm just going to bring you in for a short while. In response to this question that we just talked about in terms of herd immunity, I think you've got something you want to say about that. But also, I want you to sort of expand on this. For somebody who's done quite a bit of written work and research, having engaged with a number of ulama on the issue of tawakkul. And I think, even though somebody who's read into this quite considerably, and ulama always start the subject of tadawi bil muharram, they always start off with the first area, which is also the main issue of tawakkul. How does tawakkul? Is this khilaf tawakkul? Is it goes against tawakkul, or so forth? So this is where our theology comes in. I trust in Allah. I don't need to take no vaccine. I'll go to the masjid, I'll do all the wonderful things that I need to do as a worshipper, and I have tawakkul. Why am I taking these? Okay, ulama said it's permissible. Okay, they're not maybe pushing the agenda forward in terms of vaccines, but I don't want to take it. I have tawakkul. I have a higher level of iman. So, Dr. Asim, how do we address this from an Islamic bioethical sort of perspective, or theological position on this?
Bismillah. I'll address the issue about tawakkul in a second. I just wanted to say, in contradistinction perhaps to maybe the other panelists, I will tell you I am interested in your taking a vaccine. And I think that if we say we're not interested, I think that's a little bit problematic from my perspective as a Muslim. I'm an ER physician. I wear masks all the time. I'm taking care of people. I intubated the other day as someone who had COVID-19. And I am worried about your health. I'm worried about my health. I'm worried when I work in the ER and I go home, I stay in a hotel at times. I shower. I don't take my clothes. I don't want my kids, my wife, her parents to get ill. So I think as all of us as part of the global community, we are, right? You've seen those campaigns. We are asking for us to do our utmost so we don't transmit, the disease to those who might die from it. One of my closest friends from college presently is an ICU physician. He's on ECMO, meaning he is on a machine that will oxygenate his blood. He was the frontline physician in the ICU, taking care of COVID patients for months. He was on intubated, and now we don't know if he's going to survive because he has so much infectivity risk, right? Wearing all the PPE that one can. So I'll say, and I think the panel should also say, yeah, we are invested in people getting a vaccine because it's one part of that armamentarium of what we can do to reduce the infectivity amongst people, amongst our gatherings, right? So it is not all of it, but if it offers some protection to some people, and then we don't cause others to die from it, then I think this is actually something we should all be invested in. So I wanted to clarify that because sometimes we're trying to say this so you don't feel that we're getting money in our pocket because you're doing something. And I think that's true. But I am invested in maslaha nas, right? I am, as a Muslim, I am, right? As a physician, I am. I want good for people, and I am interested in that. So that's one. Secondarily, and I think, Shaykh Abu Eesa, you could actually just say this is haqq Allah. When maslaha is like this for everybody, in our fiqh books, we call it haqq Allah, not haqq ibad. Haqq Allah's right over people. This is what, right? So this is the point that when you have this sort of situation, we should not be, I don't think we should be mixing words. This is a big important thing. Now, as to tawakkul, Allah subhanahu wa ta'ala says in the Quran, and you all, I feel sorry, I'm saying this, but you all are fuqaha and ulama, right? And Allah yuhibbul mutawakkilin. Allah subhanahu loves those who have trust in Him, or reliance, not trust, reliance, utmost reliance. So in my reading, the idea I think that people say, I'm going to trust Allah and not trust people is one that the fuqaha have extensively discussed, that there is no notion that there is a canceling out of one's trust in Allah subhanahu wa ta'ala because you take the means. Except for if you believe the means have anything to do, and it's not Allah subhanahu wa ta'ala who's the ultimate agent behind everything, right? Allah has put the cure, He sends down disease, He's the one who gives effectivity and efficacy to anything. So unless you're canceling your aqidah there and saying, no, I believe that this water is going to quench my thirst, not Allah is, then they are, well, this is against tawakkul. But aside from that, there's no notion of that. Now, there are treatises, and in our Sufi manuals, our manuals about those, and the Hanbalis talk about this. Those who have a high level of maqam, they just trust in Allah subhanahu wa ta'ala. One of my teachers, I'll end with this, Shaykh Rafaqat. One of my teachers sort of talks about this exegesis in the Quran. He says, Allah subhanahu wa ta'ala says about, he says, Ayyub al-Hasan is quoted to say, A'udhu billahi minash shaitanir rajim, Inni masini dur wa anta khairur rahimin. He makes dua to Allah subhanahu wa ta'ala, right? That I am afflicted by harm, but you're the most merciful of mercifuls. And this has been explained in the sense that some fuqaha say that he's just asking Allah subhanahu wa ta'ala what's best for him. He trusts that Allah, right? You're the most merciful of merciful. So if there's a cure, He will bring it down. He doesn't need the asbab. But that maqam doesn't mean that you can't take the asbab. And other mufassirin talk about actually things that happened. So my point is that for us to say I have this high maqam, we should all have a high maqam. But that does not mean canceling out what we were supposed to do. And at times, actually, I would say that we have the aduf al-iman. We're the lowest of people, right, who have iman. So I don't think in one issue we say we have a high maqam and I want to trust in Allah, and everything else I'm not. Because that is actually counter logic. And Allah has given us this logic to think about things in that way. So that's what my reading has been. But I want to be really forceful about, yes, I am interested in your taking a vaccine. I am interested in your wearing a mask. I want the best for you and mankind. And please, if you do that, perhaps you might help me and those patients in the ER.
Okay, some very powerful words there. Okay, so let's move on. There's a clear discussion that seems to be floating around about aborted fetuses, and Dr. Muni has already talked about that, and he's told us that there are no aborted fetuses in vaccines. However, there are certain vaccine vectors that are made in fetal cell lines. Now, so what that would mean is that there was originally a case of an aborted fetus where these certain cells were taken, and then these cells were then, you could say, cloned through a whole cell line. And then what we have is we have certain cultures from these cell lines, and we actually grow these vaccine vectors in there. Mufti Amjad, you've written a fatwa on, and you specifically identify this issue, and you talked a bit about this from an Islamic perspective. So we talked about sort of haram ingredients. What about using a cell line of cells that originally come from aborted fetuses? Recognizing aborted is just a sensationalized sort of approach to the whole subject, just to really get people worked up. What's your sort of stance in your fatwa regarding this?
Well, first, from a Sharia perspective, humans in general, ikramul insan, the respect of humans, the value of humans, and I'm not distinguishing between those of faith or no faith, is highly regarded. The whole creation is there to serve humans, and humans are there to serve Allah. So the human dignity, human respect, all aspects of human behavior is something which is held in high dignity and in high respect. The use of humans or the use of human parts, and I'm not going to get into a discussion on organ transplantation or anything of that nature. I guess that we can say for another day, inshallah, or if that day has already been had, I must have missed it. But putting that to one side, the use of humans is obviously looked down upon, and that's a really diluted phrase. It's impermissible without any shadow of doubt. But as I said, with those caveats and the positions some fuqaha have taken with regards to human transplantation, where I said I'm not going to get into that discussion. When it comes to human life and taking human life, then that's again a very serious matter which the Sharia condemns in very strong terms, and it's only in certain positions or scenarios where the taking of human life is permitted. And again, that's a conversation for another day. I know there's various opinions with regards to aborting a child, or and its permissibility or otherwise. I hold quite a strong position with regards to that. Even before the soul is blown in, it's a part of the woman, and it's a part of a human. And can we permit the amputation of a human just because of a decision that they choose not to have something? So does it permit, for example, a person to say, I don't like my foot anymore. Can you remove my foot? So forget whether this has become a child now. That's a separate topic altogether. And I think what happens is we focus on the rights of this child, and we forget that this is also part of the woman. It's part of her. And I know through medical interventions, we're permitted to remove cancerous parts from a human and remove parts of a human which are causing harm to the human. And then it's the kind of, ahmanu sharain, the lesser of the two harms, and all the rest of it. But let's just focus then, I felt that background was important. So that clearly you can see where my answer is going to go, that's impermissible to take any part of a human and use it for research purposes, for scientific purposes, in order to seek some kind of potential cure. When there's no guarantee that there can be a cure. However, and it is a big however, we look at the situation now, not look at the situation, say 40, 50 years ago in the 1960s and 70s when those fetuses were aborted. And in this situation now, there are not even nanograms of DNA left within these cell lines in order to be able to say that there is human element in there. It's gone through so many phases that no longer exists. So again, I say, and this is again the conflation I spoke about right at the beginning, we give a hukum on what's in front of us. We don't give a hukum on how we got here. The fuqaha are very practically minded, and sorry to wave the flag of the Ahnaf, we're probably even more so practically minded than the Shawafi and the Malik and the Hanabila, in that we were the what-ifers. We came up with scenarios which were so unheard of and tried to come up with an answer. So, and then this other element which I want to raise as well is that as a community, we use, £1 million laboratory decisions to say that is permissible, when we see in the books of fiqh that it was a very rudimentary, empirical, observational science, that if you smell something or taste something or see something, then it's najis. But if you don't, then, go with it. We now say, oh, well, in that laboratory, we found no ppm of X in it. So that makes it haram. Well, if you took an apple off a tree or an orange off Morrison's car, you'll probably have as much in there. So that's another element we need to explore. But, we are where we are. We have these vaccines. We have got to be pragmatic and practical. Yes, from an ethical perspective, we will stand against any, abortions which are used as, or abortifeed, which is used as in a laboratory in this kind of scientific way to develop vaccines. We will stand against that now. We would have stood against that in the 1960s. However, we have these vaccines now in this current state. We apply the hukum on there. So I hope that answers your question.
Dr. Munir, for somebody who's started off our initial presentation, We've got one or two, three questions from some of our viewers, more specifically in terms of the safety profile of the vaccine from Pfizer. So there is a discussion about fertility, and in terms of the fact that it can have an impact on fertility. There's also be questions about patients who are having anaphylactic shock. So they're basically they've died from an allergy to the vaccine. Now, how seriously should we take those kind of factors in our discussion regarding the safety approach to such vaccines?
Yeah, I mean, as we move along, there will be more and more information would coming along onto these, I would call rare side effects, or something, those are very minor. In terms of allergy, of course, people were included in the trial, but not with those specific allergies. And that's what I've been stating to the British government, is that they need to specifically identify what those allergies were, because you can't categorize all allergies into the same vulnerability, while each allergy is its own. And it's very easy to identify that allergy. So as it stands, of course, this is a concern, but US approval did not consider that. They say that allergy is not one of those conditions that you need to look for to decide whether the vaccine is going to go or not. In terms of fertility, there is as per my understanding, there isn't any concern. However, one thing that we don't yet know is that whether the vaccine is as protective in pregnant women or not. And that is purely based on the fact that the pregnant women were not part of the phase 3 trial to be tested. So therefore, they cannot be certain whether the vaccine would perform the same way as it would perform in non-pregnant women. So just to be a bit out of cautiousness, therefore the recommendation is not to be used over there. And those trials are being set up, I know internally, from few of the vaccines in 18 and lower age children, as well as in the selected pregnant women, to see if there is any safety or health concerns about fertility or so.
Okay, we have been a number of different questions which have already been addressed by the panelists, Dr. Munir in particular, and some of the other people. And these are sort of repeated questions that have just been framed differently. So I'm not going to go back to those same questions. And I did mention right at the beginning about the difference between somebody who believes in conspiracy theories and somebody who believes in real conspiracies. So we do accept there are existent conspiracies that have happened in history. However, we need to differentiate between the two. So clearly there needs to be some kind of coherence in any kind of conspiracy. It shouldn't be just something which is completely contradictory or incoherent. So go back to the early part of this webinar, inshallah, and I've addressed the three sort of main features that would distinguish between the two. So I'm not going to entertain those discussions. I recognize that there's a lot of questions focused around this. Some people get very passionate about this discussion, and I sometimes question why they're so passionate about it. But anyway, other than that, I want to finish off because we've got a very short period of time. And I think we've addressed most of the questions, but there'll always be more questions as we go along. And inshallah, maybe in the future, we can have another webinar and discuss some of the more up-to-date questions. But I'm going to make reference to all four of our panelists. Alhamdulillah, jazakallah khair for all the effort that you're putting into this, and some very informative information you've given us all. Is number one, I want you to, give some advice to our community. Like, we've got a sister here from China. We've got an international audience here. We've got a sister from China who's saying, okay, you guys are talking about the vaccines that are out there in the Western world. What about us folk in China? Yeah, and we live in a country which is quite anti-liberal. Works completely new. So things become mandatory. You don't have a choice. So people like us, what should I do? What's the avenue of who should I go to? Who should I ask? So that's the first question. So I want a science answer and I want an Islamic answer to that, if there is an Islamic answer to that. And the second point is, what advice would you give to the governments of these different countries? So we have members and organizations from a number of different countries that are online as well, who represent certain health bodies or government bodies. What advice would you give them to gain trust within their community in relation to the vaccine uptake? And remember, vaccine hesitancy is a real thing, and it's completely acceptable that we should be hesitant about vaccines. Yeah, nobody's denying that. As long as we have the right information from the right sources and we feel comfortable with that, then alhamdulillah, then there's no issue. So on that basis, those two elements of advice. So if I can start off with yourself, Dr. Munir, first, from a scientist perspective, a Muslim scientist, okay, how would you sort of deal with these two groups of people?
The first advice I would really like to emphasize onto the fact that while we have the vaccine in the corner, don't assume that this is the end of the pandemic, because we have to vaccinate vast majority of the people to reach to the point where we will be able to say that now we are having a bit of handle on to this pandemic. For just putting into the perspective, I see some of the participants are from US. The population is 330 million, and they have a vaccine supply for 6.4 million, which is equivalent to 3.2 million people. 3.2 million of 330 million is really a peanut. So there is no end in the near future to this pandemic until we really reach to the herd immunity. So until we don't have a full control on that, there is a definitely need to follow all those public health principles that have been set up to really have a bit of handle onto the pandemic. I think Shaykh Abu Eesa wanted to say something.
No, it wasn't. No, at all. I was just trying to refocus my camera.
All right. Okay. I'm sorry.
I thought you were trying to get rid of the flies.
Yeah. So that is the message for the public, and then there is a message for the government. Particularly, I want to pass some information to the developing countries. For me, problem is not the COVID-19 issue in the developed world, because they are wealthy. They already have infrastructure for transportation, for storage, for example, just putting into the perspective, in the UK, we have 70 million people, but the contracts that we have made for the vaccine, there are 355 million, which is 5 times more than our need. So I'm sure that everything is not going to be available all at once, but that is where we stand in the developed world. But problem is in the developing world, where governments are rather sleeping. They're not really thinking ahead of time that this is not a polio vaccine. This is not a TB vaccine. This vaccine will only go to the developing world when the whole developed world will already have satisfied their need. To put into the perspective, since I sit into the WHO expert panel in the COVAX facility, which is set up by the Vaccine Alliance, Gavi, WHO, and SAPI. These are the organizations that have been thinking about the developing world. We discussed that the only thing we can offer to the low and middle income countries by the end of 2021 is to provide 3% of their population. So vaccine doses for the 3% of their population for 67 countries. Those are low and middle income countries categorized according to the UN definition. So just assume that 3% of the doses are not sufficient even to vaccinate the frontline health worker in those developing countries. So this means there would be a long logistic challenge in coming months when the vaccine would be rolled out into the developed world. And then there would be a lot of issues in terms of who can travel to these countries who already have the vaccination. And then those countries cannot contract more vaccine. For example, since I'm originally from Pakistan government first put $100 million to buy the vaccine. And yesterday they increased it to $250 million to have enough assurance that the vaccine would be available. But the problem is not the money. The problem is the capability and scalability. For example, the Pfizer Moderna vaccine, they have only capability to produce 50 million doses for this year. So even if they have more money, they can't do it. So I think the message for the government is that think ahead. This is not a polio and TB vaccine. You will only get when everybody is satisfied, and that satisfaction will require another 2 years to go.
Jazakumullah khair. Some very useful advice for those of you who are from health bodies around the world. Yeah, inshallah, this is quite useful bit for you to know. Okay, right. So we're going to Shaykh Abu Eesa. Your last few words to those people who are in an environment where clearly things are a bit different to what it is in the Western world.
Yeah, I actually went into quite a bit of detail. Maybe at that time I thought it was unnecessary. In the comments, it became clear why it was necessary on this particular issue. A lot of Muslims can take benefit from this question that's putting itself forward, and the response of international governments, and actually not even governments, different cultures to this pandemic, is also a reminder of how weak the Muslims have become in their aqidah and their understanding of actually what Islamic governance looks like. You see, at this moment in time, we're looking at the Chinese example of the sister in China as the exception. and as somehow as like we're the enlightened ones that should be teaching the world. Are you flipping kidding me? Has anybody looked at the number in America and in UK, the complete omnishambles cluster yani mess that we've made of it? The people who have sorted this out, who you can spend the whole day trying to blame them for causing it, but they're Chinese and their actions at the beginning, and they're making available of the genome, the genetic information, their absolute mad attack on the spread of it is actually what is probably going to give us the fighting chance of getting this sorted within 1 or 2 years. Wallahu ta'ala a'lam. You look at the East and the political response, the cultural response, there's none of this. Yeah, wallah adim, you look at the American, I mean, UK, they're small percentage, but you look at the American kind of, what was it? Was it Florida or I don't know where it was, the news report the other day of they're in a meeting, a Zoom meeting like this, commissioners or whatever, making a decision on whether they're going, Idaho maybe it was, they're going to try to obligate the use of masks. Masks, okay? We're not talking taking flipping vaccine, masks, right? And to stay 2 meters away and social distance and all the rest of it. And while she is in the meeting, her kid is calling her on the phone, right? The clip's gone viral. And the kid's calling, she obviously is ignoring it. Then she picks up, she puts herself on mute, and the kid goes, there's 500 people outside the house trying to break in. Yeah, and you know, you will not, we will not comply. We will not comply. This is now, you know, this stupidity, this worship of the self that nobody can tell me what to do, right? Which is the idea and the vanguard of the liberal West, has now entered into the hearts and minds of Muslims. What do we have to do with this stupidity, this fake concept that we are in control of these things? And governments, and even governments that rule by kufr, right? That remind us actually of authoritative control, which is what Islamic control is. There's none of this, you do what you want and you say what you want and you wear what you want and you think what you want. This idea now has affected our own aqidah. So we're now starting to now bring our own biases into areas which actually, if you really wanted to ask what the Islamic ruling is, you have a heart attack. So don't ask about things that you don't want to hear the answer to. You know what I'm trying to say? Don't ask this question, because we're going to say that actually the whole world messed up and only the Chinese got it right, who are banning and putting a lockdown for 7 months. But you don't want to hear about a lockdown for 7 months. So, you know, when people say that people are saying this, I don't care about people. Respect to Dr. Asim, by the way, who said, listen, I've had enough of people just sitting on the fence. We should be recommending things. I'll go further and I'll say, not on the issue of medicine, I'll say enough of the people just chatting rubbish. Wallahi, the other day I gave a lecture on this, and in the comments someone said that, how can we trust him? He's a health professional. Bloody hell, what happened to, yani, what did I do? Health professional, yani, that's now an attack on a person. One person said, how dare you recommend a vaccine that has that is saying that it cannot be used in shouldn't be used in pregnant women because we haven't done tests. I said, well, don't ask about the rest of medication then, because you honestly think that medicines are tested on pregnant women. You know, you got people who are just putting out their own kind of fears, their own ignorance, and people are listening. People have just got to remember, Muslims, فَتَبَيَّنُوا, as Allah says in the Quran, فَتَثَبَّتُوا, as Allah says in the Qira'ah. Yani, there is a requirement upon Muslims to clarify what people are saying, to establish the proof of what people say. Not everything that everyone says is to be just judged by your mind. We have Islamic principles. Anyway, that's enough to be said on that.
Mufti Amjad, your opportunity to address these individuals in these remote parts of the world, and also some kind of advice to health bodies, you know, the people who are on the front line are trying to go out and give these vaccinations, and they need some kind of engagement program to get some sense of trust amongst people. What kind of advice would you give somebody who's come from, you know, a number of different backgrounds?
I'm glad you reminded me of the question, because after Sheikh's bayan, I completely forgot what the question was. I forgot completely what I was actually going to be asked. I hope he doesn't say, what's your views? Because I won't know what to say after that. I'm glad
and I picked that up as well, so that's why.
Thank you for that. Thank you for that little tip. If I can focus, I don't get much out of Bradford, so if I can just focus on more local rather than international affairs, and just to cite an example, Bradford was looking at carrying out some trials on this vaccination, and they only managed to get about 500 people. And out of the 500, there was only about 14, 15 from the BAME community. And out of the 14, 15 from the BAME community, I think there was about 6 people who had so-called Muslim names. So they were kind of kicking up a bit fuss that, you know, I wouldn't say that, you know, there was any level of prejudice, but they were sort of saying, why aren't the Muslim community coming forward, whatever. And you can see how certain members of the wider community can start, you know, with all their, or Muslims don't necessarily follow rules, they don't care, and all the rest of it kind of being spun into that. However, it wasn't as sinister as that. What it was basically was no communication at all, hardly anything, you know. So when someone spoke to me and they rang me up and I said, look, I don't even know about it. You know, and I know what goes down in Leeds Road and whatever else. So if I don't know about it, I don't think you've got much chance of anybody else knowing about it. So it was only when we started having conversations and then we ran a similar Zoom thing like this. And I think then the following week, it went to Bradford being the second highest in the UK. Now, as I said, I'm not necessarily, you know, condoning whether someone takes it or doesn't take it. But my point is, and I've said this from the beginning, is that we need to give informed choices to people. They need to understand the repercussions of certain things. They need to understand what will happen if they don't take it, and they also need to understand what the Sharia says, so that people aren't blindly blaming the Sharia for sort of saying that, you know, we're not permitted to take this, because that was some of the feedback that we were getting from the health professionals, that many people are saying it's impermissible for me to take this. So people are kind of just kind of guessing at things as well. So you know, I think that enlightenment, and that's essential, that we continue this kind of conversation. But health bodies, health authorities, local councils, government bodies need to engage with those communities which it claims they're serving. So if it's serving the BAME communities, if it feels the BAME community are being adversely affected by this more than anybody else, then it doesn't make sense if you're not engaging with them, because who are you engaging with? And on the last point, you know, we can see lots of questions and debates going on as I'm watching this streamline on the Zoom webinar chat, where everybody's kind of giving their own opinions. And that comes back to the last point, is that sometimes we ask questions and then when we're given a Sharia response, nobody wants to act upon it. Yeah. So sometimes people will say, so, you know, a question comes up that, Mufti Sahib, is it permissible to pray Salah with gaps in it? Well, if I say to you it's impermissible, what are you going to do? You know, so it's this kind of mindset that we are trying to navigate in waters which we've never been in before. We're trying to navigate and maintain as much of our faith and identity as we possibly can. So it doesn't help by, you know, kind of posing questions and issues, which is like ulama thought, well, that's a good question, isn't it? How come no one else thought about that? So, you know, I think there's got to be a fair bit of respect that's offered to both the health experts and those who are leading us in terms of our Sharia. Jazakallah khair.
Jazakallah khair. Dr. Asim Padella, I finally leave it with you. For somebody who is quite heavily engaged with health, governing bodies and people like that, I thought you might be able to give us some more relevant, appropriate advice, specifically with your experience to these organizations, because this is your expert area.
Allah alam what I'm expert in, I don't quite know, but I would say two things just to address, because we're over time. I think everything that happens to us is not is there for a purpose, right? Allah subhanahu wa ta'ala is in control. And I reminded in the end, you said, what is the guidance to those polities who might not be in UK, US, wherever else it is? Well, the same applies to all of us, right? The Allah, you know, if you protect, not protect, but if you're mindful of Allah subhanahu wa ta'ala, you know, that you should know that He's the one who's going to benefit you, and He's going to one that's going to harm. There's nothing that can happen without His leave, right? So we should, this entire and every aspect of our life is about that. We should need to reconnect with Allah subhanahu wa ta'ala, trust in Him, take the asbab where we can, but always know that He is the one who brings benefit, and He's the one who brings, you know, and can protect us from harm. So that's my advice. And if authorities or others are saying things, your trusted advisors are, you know, take what they say, make your own istikhara, trust your heart, make dua that Allah will open doors for you for khair. And as far as this trust business, I appreciate what Mufti Amjad is saying. I think the responsibility again comes to us. I don't want to talk about other people. Yes, trust must be earned. Yes, as researchers, we need to be going and connecting with those underprivileged and marginalized communities, right? There need to be outreach, but it's also on us that we should be invested in the benefit of society. I'm not saying go do research trials. I'm saying that you should be going to the hospital systems and the healthcare authorities and asking them about what is going on, how can I participate, how can I help connect you to marginalized communities, because we have to be responsible citizens as well. And I think some of that problem is our own. We are not responsible citizens. You can see what happens in masajid parking lots. We're not responsible citizens, and then we claim someone's not doing something for us. But what are we doing? What are we doing to get involved and help? And as I said in the chat box, I think that we only, one of the opinions around people are upset about people saying this is haram, that's haram. But we're in this situation because we shirked our own responsibilities. We have both ulama and an. And unless we take responsibility, there's no way out of it. So I am trying to teach my own children, my students, be responsible to yourself and Allah subhanahu wa ta'ala and community. And inshallah, I'll be khair in it. But that's our only hope, that we have to be responsible for ourselves and our environment and not leave it to others to take care of us. So jazakallah khair for this panel.
Just to give my sort of perspective on somebody who's worked with health bodies and been part of a health body sort of setup with the Bradford City CCG, various other things. My advice to sort of people who are involved in dealing with certain vaccination programs and various other things and trying to get some kind of, or dealing with the issue of vaccination hesitancy, which clearly is real and it should be, is number one, you need to gain the trust of the people. And the only way you're going to gain the trust of the people is be honest. If you are honest, then you will slowly see that the people will begin to trust. Now, there are individuals who feel that there is an underlying conspiracy to everything, and that's something that will always exist. It's not something that's going to go away overnight. Especially, we know that any kind of idea around these conspiracy ideas, they tend to arise when they see things happening on a larger scale. So if you see things happening on a much larger scale, then it's inevitable that's only human behavior that we're going to behave in that sort of way. But you just have to earn the trust of the people, and you have to make sure that the information you give them is honest and truthful. Don't try to sell something like you're selling a product, over a counter, and you use any kind of tactic to sell this. Be just honest and let people make that decision themselves. And that's what we hope that we have been doing, inshallah, today. I know there are individuals, I know personal individuals who will be saying, Dr. Saab, you've been, really putting a slant to this whole thing. You're trying to promote the idea of vaccinations. I know people are going to talk about that, but at the end of the day, what's really, really important is we are all accountable to Allah subhanahu wa ta'ala, So at the end of the day, if I have done anything wrong, or I have had my own personal bias, I'm a GP, okay, somebody from the medical field. I have seen individuals die from COVID, and I really mean that, yeah. My own father passed away because of it. So I am somebody who's very, but yet I will take all my emotions to one side, and I will still be hesitant about vaccinations, okay? But I'm going to use my information from reliable sources. So I will approach ulama who have a good understanding of the fiqh related to this particular area, which I would want them to also have some kind of science background or some kind of understanding of science. Okay, not just general ulama. I'm looking at people, ulama, who have an expertise in this particular area, more so. And the one really important quality is that they have taqwa and they are adil. Now, if that is all that is required, and that is all that Allah subhanahu wa ta'ala demands of us, that we look for those people who are trustworthy, have taqwa, who are adil, and then you rely on them. Because you are not an expert. You can't go out looking, searching. Unfortunately, we have people who have absolutely no expertise in this area. And they are firing away with all these WhatsApp messages and all these social media messages all over the place and coming out with all sorts of wonderful theories. In fact, I just recently joined a Telegram group of one person who's just throwing everything he possibly can against vaccinations. And it's an interesting group. And it's a group that you can't engage with because it's only one-sided message that he can send. But wallahi, this guy needs lining up and shooting. He's really deceiving the community. Honestly, there is something where you have an extreme, and there's something where you are, a bit, conscious about really what reality is. So let's be real about this, okay? And let's be frank about these issues. So, we need to really think about this carefully. This is not a small issue. It's a very real issue. It's a serious issue. Hopefully, if there's anything that we've done, is we're not here slanted to one end and saying vaccinations, go ahead without question. Question them. Have that element of hesitancy, but be rightly informed and make the right choices. And then we leave everything else to Allah. Take the sabab, and then we turn to Allah subhanahu wa ta'ala. Have tawakkul in Allah that Allah subhanahu wa ta'ala will cure us of these waba and these illnesses around us. And may Allah subhanahu wa ta'ala give us tawfiq to be able to act on what's been said. And may Allah subhanahu wa ta'ala also bring shifa kamila to our communities from all sorts of illnesses, because it's not just COVID, there are many other illnesses in our community. Unfortunately, we are at the receiving end of most of them. So inshallah, we make dua, we turn to Allah subhanahu wa ta'ala finally and foremost, because Allah is in control of everything. We leave at that point. I want to thank our panelists immensely for their contributions. I know they're doing immense work out there in the community. They don't just worry about COVID. There are many other things to worry about. But inshallah, this is a very important area. So we've addressed this through Al-Balagh webinar series. Inshallah, hopefully you can all understand our predicament here. Subhana rabbika rabbil izzati amma yasifun wa salamun ala al-mursaleen walhamdulillahi rabbil alameen. Assalamu alaikum wa rahmatullahi wa barakatuh.